Welcome guys. Today we will continue our series that is the must know MCQs or must know 50 MCQs of pediatric. So, today we will discuss the 50 questions that are most important in pediatrics. So, we will try to cover it in less than 10 minutes. So, let us start. The first question is, which primitive neonatal reflex never disappeared? The answer is parachute reflex, which is never disappeared. Then Moro's reflex appears by which age? That is 28 to 37 weeks. So guys, remember that the milestones are very important topics in the pediatrics, and every time the question are asked on milestone. So next is bag and mask ventilation contraindicated in which of the following condition? That is congenital diaphragmatic hernia. The bag and mask ventilation are contraindicated. Then moving forward, bronze baby syndrome is adverse effect of which of the following therapy? That is phototherapy. Phototherapy which causes the bronze baby syndrome. Very important. Then Shakir step used for mid-arm circumference. So remember Shakir step which is used for measurement of mid-arm circumference. The three zones are there: green, yellow and red zone. Then next, birth weight of baby doubles at every 5 months. This is important. That is birth weight of the baby doubles at 5 months. Then length of child increase by 100% or doubles. Weight doubles by 5 months but length doubles by 4 to 4.5 years. Remember these questions, these are very important. Then mode of inheritance of achondroplasia. Achondroplasia is autosomal dominant mode of inheritance. Then acquired microcephaly seen in Rett syndrome. Then most common cause of congenital obstructive hydrocephalus in child. Obstructive congenital hydrocephalus. Most common cause aqueductal stenosis. It is very important and frequently asked question, that is congenital obstructive hydrocephalus. Most common is aqueductal stenosis. Moving forward, first tooth to appear in secondary dentition is first molar. Remember this. And last tooth appears in primary dentition. In secondary dentition it is first molar, and in primary dentition the last tooth is second molar. These are confusing one. In second it is first, in first it is second. Remember this trick. Then sitting without supports come at the age of 8 months. 8 months sitting without support. These are the milestones of the baby and are asked frequently. Then rides a tricycle 3 for 3 years. Sitting without supports 8 months. Then transfer object from one hand to another 7 months. Then immature pincer grasp comes at which age? 9 months. Immature, here immature. Then mature at 12 months. Okay. Immature pincer grasp comes at 9 months. Child copy a circle at which age? 3 years of age. Circle. Copy circle at the age of 3 years. These are the milestones you have to remember. Significant delay. Next, moving forward, significant delay in 2 or more domains of development. 2 or more domains of development, it is called global developmental delay. 2 or more domains, significant delay. Okay. Then milestone occurring out of sequence are called developmental deviancy. Means transfer of object one hand to another 7 months, then immature of 9 months. If it is altered or not occurring in a sequence, that is first month, second month, third month, these are not followed, then it is called developmental deviancy. So moving forward, breastfeeding should be initiated after childbirth. within 1 hour. This is the question everyone asks, and you have to know about the breastfeeding. Exclusive breastfeeding should be continued for 6 months. Exclusive means no top feed, no other feed you should give. Then, for how long can express milk milk to be stored at room temperature? At room temperature, 10 to 8 to 10 hours. In a refrigerator, 24 hours. At room temperature, 8 to 10 hours breastfeed milk can be stored, and at refrigerator, 24 hours. These are main points about the breastfeeding. Then, absolute contraindication to breastfeeding. It is very important question and asked many times. It is galactosemia for baby. If asked about baby, that is absolute contraindication of breastfeeding due to baby cause, or in babies that is galactosemia, or in mother it is on chemotherapy. Mother on chemotherapy will give you absolute contraindication, and for baby it is galactosemia. Very important questions. The weight for height less than 3 standard deviation or less than 70 of expected is called severe wasting. Less than -3, okay, it is severe. Then child with edema, apathy, fatty hepatomegaly, skin and hair changes, it is a feature of Kwashiorkor. Guys, remember Kwashiorkor and marasmus are very important diseases, and none paper is going without these two diseases. Then X1b is associated with Bitot spot. X1b associated with Bitot spot. So treatment of vitamin A deficiency, age oral dose. Less than 6 months it is 50,000 international unit. 6 to 12 months 1 lakh international unit. Remember this. In immunization, vitamin A is given 6 months of gap. Then glossitis, cheilosis, angular stomatitis, keratitis is a deficiency of vitamin B2, that is riboflavin. Then diarrhea, dementia, dermatitis, death, it is B3. B3, remember D's of the B3, that is niacin deficiency. Diarrhea, dementia, dermatitis, death. Then neonatal seizures can be seen in which vitamin deficiency? That is pyridoxine. Vitamins are important questions. Vitamin niacin deficiency cause dementia, dermatitis. Then neonatal seizures in pyridoxine, and vitamin deficiency that causes collagen defect, that is vitamin C. Okay, then moving forward, calculate maintenance of fluid required in children. First 10 kg 100 ml, then beyond 20 kg 20 ml per kg, then next 10 kg 50 ml per kg. First 10 kg 100 ml, then beyond 20 ml, and next 10 kg 50 ml. Okay, then moving forward, in all children of an affected female are diseased, that is mitochondrial inheritance. Affect is in female are diseased, then it is mitochondrial. M for mother, female, so mitochondrial inheritance. Father to son transmission rules out X-linked. If it is fathers to son transfer of disease, you can rule out the X-linked diseases. Then most common chromosomal abnormality in children, it is trisomy 21, that is Down's syndrome. Very much important, Down syndrome, most common chromosomal abnormality. Then short stature in female with primary amenorrhea is seen in Turner syndrome. Primary amenorrhea is a key point here. Then as per PALS guideline, A for airway, C for circulation, B for breathing, D for disability, E for exposure. ABCD PALS guideline, that is airway, breathing, circulation, disability and exposure. Then moving forward, bilateral oil drop cataract with jaundice seen in galactosemia, the contraindication for breastfeeding. Bilateral oil drop cataract with jaundice. Urine turns black on standing in ALK proteinuria. Black on standing, ALK proteinuria. Then Koplik spot is seen in measles. Very simple but important question. Koplik spot. Then slap cheek appearance seen in erythema infectiosum. Slap cheek appearance in erythema infectiosum. Hand foot mouth disease caused by ear Coxsackie virus. Correction, Coxsackie virus. Then BCG, OPV and hepatitis is given according to NIS at birth. So we have covered a video on immunization. So go and watch there. We have covered all the vaccines. Then fraction IPV2 is given at the age of 14 weeks. 10 weeks is not present. Go watch the vaccination video. Here is correction, not a pox virus, it is Coxsackie virus. Then vaccine that do not follow open vial policy, BCG MR. I also covered open vial policy in vaccine video. Then drug of choice for Kawasaki disease, that is IVIG. It is important, IVIG. Important complication of untreated Kawasaki disease, that is coronary artery aneurysm. DOC is IVIG and complication in coronary artery aneurysm. Then CFTR, gene mutation seen in cystic fibrosis. Cystic fibrosis, CFTR gene. Which channel is affected in cystic fibrosis? That is chloride channel. These two questions are repeated many times. Chloride channel, CFTR in cystic fibrosis. Stipple sign seen on X-ray in croup. And thumb sign in acute epiglottitis. These two signs are important. Steeple sign and thumb sign. Steeple for croup and thumb sign for acute epiglottitis. Thank you. We have covered in less than 10 minutes.